Hello, everyone. I'm Katie Adams with MedCity News, and I'm here with Jason Prestanario, CEO of health data platform Particle Health. Thanks for being here today.
Yeah, thanks for having me.
Of course. So I've been hearing a lot about data interoperability this year, and of course, always hearing about the challenges of interoperability in healthcare. But I'm wondering where we've actually seen real progress, if you can point to any areas where we've made meaningful change in data exchange, maybe over the past couple of years.
Yeah. I mean, you know, I get to see something that a lot of people don't, which is just tens of thousands of these queries flowing through, the national health networks every single day. We've made very clear progress on coverage, right? So here at Particle, we can, reach medical records on 320 million patients across 70,000 plus healthcare organizations. We actually see 125 million interactions between patients and providers each and every month, which actually comes down to, if you do the math, about 50 times a second. So 50 times a second, right? We're seeing all these interactions. That's real, right? That is a lot of data. That is a lot of real interoperability moving through the system. But it also allows me to see where the system is still breaking down. Right, we see valid queries that sit in limbo for weeks. We see response times that vary depending on who's asking for it. The infrastructure is there, but the ability to use it is inconsistent. I can give one just quick personal example that I've seen in my own life. My son was born December of 2024. And we had some concerns on his bilirubin jaundice levels. And so we ended up, it's very common, and he's totally fine now, but we ended up having to take him into the ER when he was kind of on his fifth day of life. And when we came in, one of the things that's sort of interesting about bilirubin and jaundice is you have to kind of plot the levels over time, because as the baby sort of ages, right, the levels that are appropriate or not appropriate change. And so knowing when, the timestamp and the actual level, you kind of chart out this chart. And, so therefore, as we're in and, she's saying, okay, great, this nurse is trying to understand, where our baby's at, and we can take the level currently, but I want to add the history. Perfect example, right? Where interoperability and being able to understand what's happening to a patient, in this case, my 5-day-old son, is important. And she actually asked me if I could pull out my phone. We had records both at the hospital he was born at, which was actually a different hospital, and the pediatrician. And she actually asked me to pull out my phone and literally log into, right, the portals, so I could show her the bilirubin levels for my son. And then she took out her phone and took a photo of it and said that's how we were going to, she would go and transcribe it, into her EHR. And this is NYU Langone here in New York. And I asked, I was like, well, don't you have, Care Everywhere, a way to kind of pull this information and pull it digitally? And she said, yeah, it doesn't really work. We don't really trust it. So I'm just going to enter it manually. And to me, right, now in retrospect, at the time, obviously I was mostly just concerned with my son, but in hindsight, this to me completely encapsulates what we need to fix with interoperability. A nurse that is on, her shift shouldn't be needing to spend time taking photos of people's phones and manually entering in, those details. That's what we got to fix.
Yeah, well, I'm sorry that you had to deal with a process as slapdash as that, right after your son was born. But unfortunately, I think, things like that are all too common today in the system. So as we look to fix interoperability, I'm wondering, what emerging standards or new technologies you're most excited about to help drive that change.
Yeah. So, of course, what immediately comes to mind is AI. Artificial intelligence is changing everything. There's no question about it. But I think in healthcare, it's really interesting to think about what and how AI will be used, because I think it's not often the way that most people frame it, right? So right now, today, if you actually look at where and how AI is impacting healthcare, and there's a study put out by Menlo Ventures, which actually shows that AI is being adopted in healthcare faster than pretty much any other industry, which is amazing. But if you actually break down where it's actually having the biggest impact, it's really a lot less in things that are actually about clinical information and what's going on with the patient, and rather just replacing, banal workflows. So obviously, scribes get a lot of, insight, but they're just kind of writing stuff down from very, well-paid, very expensive, very important labor, but still just writing things down. A lot of the other areas are, areas where people are jumping on the phone to, get prior authorizations received. Again, a very sort of banal workflow. And, the realization for me is that for AI to really impact our understanding on the clinical side with patients, it needs more than just obviously this incredible technology. It needs the ability to understand and have access to the data, the medical records piece that actually allows us to really influence how care teams can effectively treat patients. And that's, what we're really excited about and what we're doing here at Particle. So as an example, when a patient is discharged from a hospital, traditional ADT alert can confirm that, a discharge happened, but it's not going to have all the rest of the information around the discharge summaries, procedures, labs, vitals, why the patient was there, what the rest of the patient's, medical records and history are. And so what we've been able to do with our AI-powered Signal product is really provide all that missing context, summarizing what happened to that patient throughout their hospital stay, but also throughout their entire history, which really leads to a robust, rich understanding and gives, right, AI the information and data it needs to really thrive and go from, again, sort of replacing banal workflow to really actually empowering care teams and allowing them to follow up in that critical post-discharge window, avoid readmissions, close care gaps, and optimize post-acute care. So, again, AI is incredibly powerful technology and is going to, of course, I'm not the first to say it's going to change the world, but I think thinking through how it impacts healthcare and how it impacts really patient care, I think we have to make sure that it has the data and insight it needs to really thrive.
Yeah, well, there's certainly no shortage of data out there. There's so much healthcare data that exists within the system, but the key is, as you mentioned, really moving it into the right places so that it can thrive and that it can be incorporated in the workflows it needs to be integrated into. So there's certainly a lot of work to be done, as you described. Right now, it wouldn't be uncommon for a nurse to have to take a screenshot of her personal iPhone, a little
Yeah.
picture of a record from yours. But long term, I'm wondering what your vision looks like for how health data infrastructure should function within our healthcare system, and what kind of changes we need to make in the industry to get us there.
Well, listen, I mean, I think my vision is actually quite simple, right? A patient's complete health information should be available whenever and wherever they're receiving care. Any gap in that at all should be unacceptable. And this isn't a particularly radical idea, right? It's really sort of asking for the bare minimum that we should expect from a modern healthcare system. Unfortunately, though, access today remains deliberately constrained by data monopolies with misaligned incentives, which leads to delayed care, duplicated tests, and preventable medical errors. And so in order to kind of get to that reality, right, I think what we need is just a true national network where query and response is mandatory, not voluntary. And we need real enforcement with real penalties. Anything else, just leads to mandates without the real enforcement mechanisms and carrots and sticks to make it a reality. Um, we need to stop treating information blocking as an administrative issue, and start treating it as a patient safety crisis, because that's what it is. And if and only when, right, we get to having that actual accountability in place, that underlying infrastructure can do what it was designed to do, right? The technology exists. It's really a matter of ensuring that we have the right uh, pushes in place to ensure that we can use it and innovate in healthcare and really get to a position where this healthcare crisis, and it is a crisis that we have here in this country, we can start to get beyond it and get back to ensuring that patients get the care they deserve.
Well, I can certainly see why you would frame it as a patient safety crisis. So thank you for pointing that out, and thank you for sharing all this insight with us here today.
Yeah. Well, thank you very much for having me. It's been a real pleasure.